So Camille, I was just wondering, following on from our last conversation, you know, with the progesterone cream and the discussion we were having about PMS and that.
Yes.
I was just wondering, do you have, do any of your patients, or do you get them to have a test done first for levels of progesterone or not?
Well, sometimes I do if they are someone that needs tests. In other words, if they need the physical proof. But honestly, I've done this with over 1,200 women at this point, and so I know how to recognize it. And and I don't need the test for myself.
Yeah.
Especially because, as you saw from what I described in the protocol, it's so individualized as to how much a person needs each day.
Sorry, hold on.
It is a funny day, isn't it?
This is the age of technology.
I guess. Well, we're all going to take a big, giant step back from it because the virus is sweeping through Microsoft and Amazon.
So sorry about that.
Not at all, Mary Jo. Not at all. It's a funny day.
So, so you don't.
So I only do it if they are the kind of person who needs tests, because it doesn't actually tell me anything that I need to know. It will tell me that they are low, but I already know that. And it doesn't affect how I prescribe, because the way that I prescribe is so individualized. It really is a matter of tracing the person's cycle on a day-to-day basis and having them try it and refine it. And for some people, it can take 2 or 3 months to really refine how much they need on each day of the cycle or each section of the cycle. So it doesn't, I mean, testing progesterone itself is not that interesting to me. What is interesting to me is sometimes doing a more complete hormone panel. So for example, testing DHEA can be useful because maybe all their hormones are an issue, because you have to support them at the base. Because without DHEA, their adrenals are going to be low, their thyroid's going to be low, their testosterone's going to be low. So that can be a more important thing to get a sense of, because maybe doing progesterone isn't going to be enough. And there are nice DHEA supplements, but they tend to be, at least in this country, the dose is way too high, in my opinion, dangerously high. And people really like to take DHEA, particularly, honestly, men, because it supports their testosterone, and they love that, and it makes big muscles and all of that. But it's, so people end up with time. So and person can take a 1 milligram drop, and then they can decide to take 5 or 10, and I don't even have them take it every day. Usually I'll have them take it every day until they start to feel an effect, and then I might go to twice a week or once a week or something like that. DHEA is very powerful, but for some people that that can really make a huge difference, because it really can help their overall energy level tremendously. You know, and then I might want to do a full and complete thyroid panel, because thyroid and progesterone are directly correlated, and when the thyroid goes low, then progesterone can go low, and vice versa. And thyroid, particularly Hashimoto's thyroiditis, is a huge problem out here. I think in the US in general, but also I think particularly in California, since we've been getting a lot of the irradiated iodine that's been pouring out of Fukushima since 2011. And I do feel that that is an issue. It's a fairly undiscussed issue, but I do think that that's important. And I see a tremendous amount of thyroid problem and Hashimoto's problem. So to do not just TSH, but a really full comprehensive thyroid panel, where you're looking at antibodies and all of that sort of thing, I think is really useful. So, you know, I would put it in a larger context, not just do progesterone, but because that's it's a relatively useless number, except you know, I might do it if we to look at lab tests. Is the protocol not sufficient? And sometimes it's just because their levels are so low. I mean, I remember even one teenager where her levels were practically zero on progesterone, even after some supplementation. I mean, we just couldn't get the levels up. And it turned out to be more of an issue with medications that were suppressing her hormones and that kind of thing. So answer, not off the bat, but in special circumstances, yes.
Yeah. Great. Okay. Thank you. Yeah.
Oh, okay. Was that clear? I mean,
Yeah,
did I come through okay?
You did.
Oh, okay. Okay, good.
There are times when your voice got very elongated. But as a whole,
Okay.
one could sort of make it out.
But it was understandable.
For the most part, yes.
Yeah.
Okay, good. Okay.
I've lost I think both of you now.
Sorry?
Are you still there? Yeah.
I'm still here.
Yeah. Okay.
I'm still here.
All right. Anybody with anything else?
Do you have anything, Camille?
Well, I'm kind of curious, and again, I'm sorry, I'm a little obsessed with virus issues, but here in California, it's a big deal. What would you do, Avi, more for acute immune issues, like above and beyond Kiko's immune protocol?
Quite honestly, not a huge amount. I mean, it really depends. I think that, okay, so if it's a person that comes to you regularly, you know, like it's not their first visit, okay? Well, and even if it is, I think it's not about, okay, so what I do is not similar to what the TCM ideology is, which is, oh, you have wind-cold invasion, we should treat the wind-cold, and it really doesn't matter, you know, we should not touch the rest of you, because, you know, we can't tonify, or we can't do this when, you know, because these are quote unquote contradictory strategies, right? So the way I treat everything that there is in a history regardless, okay? Because their immune system is not separate from, you know, their whatever else they're coming for. You know, let's just say that they have endometriosis. Okay, so if they have endometriosis, I'm going to do Moxone liver 5, no matter, it doesn't, you know, so they have a cold, I'll still do Moxone liver 5, because that strengthens their body's ability to respond no matter what. So I don't have a huge amount of like tricks and of course I have not seen a coronavirus patient yet. And
No,
maybe I'm
neither have
hoping
I.
not to either, or maybe I have, I don't know. It's possible that I have and I don't know. So, but in terms of doing things, and that's the thing that, I'm looking at all this stuff that's out there on the internet, amongst acupuncturists and, and in the general population. And it seems to be people, I mean, it's now we're beginning to get like pretty high numbers, in other words, we're starting to see a lot of cases. A lot of the information that we're getting, out of China in terms of formulas are like a month or two old at this point. And at a time when the number of cases were not very high, and, the Chinese love to dogmatize. So they love to say, this is a damp heat disease, you should treat like this. And I'm looking at this and saying, and how the hell do you know? Like, what's your experience? I get that you took the pulse, you looked at the tongue, and you said, okay, it's this. This is the dogma. And now people are starting to say, well, is this, does this dogma even fit? Does this fit a wind cold, a wind heat, a blah, 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 and I certainly don't know because I haven't seen it. But, you're starting to see people questioning, okay, should we just give everybody Yu Ping Feng San, which is what they're supposedly recommending in China. So for me, as an acupuncturist, I'll give people herbs if, occasionally, but generally it's not my field. I'll treat everything that they come with. And in terms of if I want to protect the lungs, I'll specifically, so I will look, so besides immune points, yeah, okay, I will look at lung 5 because it is the virus that attacks the lungs. So I would look at the whole area between the scapulas, the rhomboid area, T2 to T7 between the scapulas. And moxa, anything that I, release anything that I find, but then moxa it also too. It's important that tissue in the chest, both for cardiac and lung issues, it's important to go directly with moxa at the end. After you've done everything you can to resolve it, you want to because what happens is the tissue around the lungs gets sort of a little bit thick, and puffy, so it congests. It makes it harder for the lungs to work, and the same for the heart. Okay, so you need to kind of make the tissue around it less congestive. Specifically in terms of lymphatics for the lungs is below the scapular spine, needling upwards, so it's below small intestine 12. Okay, these are considered very good for lungs. You have the Kawai's protocol for lungs and for coughing, which is do 14 Watto. Bladder 13 line, you can do Watto or bladder 13. T7 line, again, bladder 17 or the Wattos. And bladder 20 line, okay, and or Wattos. And I would add moxa to all of these. So when I'm treating people with lung issues, cough issues and stuff, I do that on the back. So on the front, I usually do, now spleen 4 is a good, quote unquote, antimicrobial point for, anti-inflammatory point for the lungs, spleen 4, and with lung 5, which is kind of a little bit like asthma treatment for when the problem is breathing out. Okay, so that's kind of, so those are the things I would think about in terms of what I want to do.
Nice. If
for besides treating, okay, and besides the fact that you have endometriosis kind of thing, so that those would be the things I can think of straight off.
Thank you.
You're welcome. Anything else?
Mary Jo? Well, no, Mary Jo will ask a question and then it makes me think of other things.
I know, I'm laughing. I'm laughing because you always say that.
Well, it does. It's very helpful.
Okay, so I have just one thing I thought you might have some thoughts on, Evie, is skin diseases, you know, like psoriasis and eczema and that kind of thing.
Great.
But you might.
The easy stuff, right? So officially, skin belongs in the category of kidney 9 and large intestine 15. Now, you have a bunch of, now if you're talking about psoriasis, it's an autoimmune disorder. Okay, so, okay. So if it's an autoimmune disorder, you have the autoimmune protocol, which is kidney and lung points, and REN4, and the equivalent of the back will be bladder 27, plus say UB52 towards the spine, or UB23, plus UB42 out towards the scapula, or UB13. Now, a number of things to look at skin is skin can be either lungs, because, oh yeah, the lungs responsible for the skin, but it's not that common, okay? And but it can be, and it can certainly be an immune reaction, you know, histamine kind of issues. So it can be an immune issue. So immune lung, it can be in that axis. It can have stuff to do with the liver, you know, in terms of the quality, you know, toxicity in the blood. The liver is not pure, you know, not detoxifying the blood, you know, which supposedly large intestine 15 is supposed to affect that, but you know, you can treat the liver also. And the one that I think people don't consider often enough is that skin issues are often associated with kidney diseases. Weak kidneys basically means not good filtration, therefore stuff you know, the skin gets very sensitive. Okay, so people with kidney problems, I'm talking about Western kidney problems, will have weak skin. Okay, so that's another consideration. The other one is if you have oozing skin, that's not the most common skin problem, but if you do have oozing skin, then bladder 63. Bladder 63, the so-called boil, you know, the point for boils, or also for explosive diarrhea. In other words, anything that's to do with damp heat, kind of toxicity, UB63 is a good point for. So, for example, if you said coronavirus is a damp heat toxin, so UB63 should be a good point. And the name of it is the metal gate, Jinmen. So it's supposed to have something to do with the exterior, in a way. So I mean, I you know, that with of coronavirus was totally basically rubbish as far as I'm concerned. I mean, it will be interesting to test it. I will say, by the Camille, in terms of corona, there is a whole bunch of protocols in older literature of moxa points for TB. And there's an organization called Mox Africa that's very big into that. And so I think I don't think you can apply it like directly, but I think that, you know, that's something to look at. I mean, we generally kind of ignore TB, you know, we because we don't see it. So we're looking at protocols for TB and we're going, whatever. I've looked at it at some point more because I thought it might be useful for Lyme. So, well, there's similarities.
Interesting.
You know.
Interesting.
So I mean, if just go look up Mox Africa, MOX Africa, and they have like a lot more interest in the TB thing because they are in third world countries where, you know, TB is prevalent. I mean, you know, there is TB in this country, especially in inner cities, but it's generally, you know, not considered, you know, most people could kind of consider it as a, who cares? You know, and, you know, even if TB is resistant to antibiotics, we still don't look at it anymore as a serious issue. But yeah, so in terms of skin, that's kind of like my go-to would be make sure, look at the kidneys, look at the kidneys, look at the immune system, look at the liver. And then in terms of like automatic points, it'll be kidney 9, large intestine 15 would be the first two.
Mhm.
Just one person that I'm thinking about has psoriasis on the scalp.
Uh-huh.
So that would be some.
Well, so yeah, I would still do kidney 9, largest 15. I would still look at psoriasis can be an autoimmune disorder. I would look at treating it, like with externally. I mean, sulfur sometimes works for psoriasis.
Yeah.
Sulfur baths.
Yeah.
Kiko once had this really quite not very appetizing decoction, so to speak. You take you take a dozen eggs and you put them in vinegar and you wait for 2 weeks. So basically they're releasing the sulfur. So you get this gooky, eggy shit, basically, and you put it on the psoriasis. I kind of suggest, well, just take a sulfur bath. I mean, why would you have to wait with the eggs for 2 weeks? Blah, 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 blah. Now, it's possible that the eggs have a specific healing property on top of it. I don't know. But I think sulfur should do it. And the other thing is if it's in a particular spot, like say it's, in the back of the neck, that would be a typical place. You can try just putting press tacks there, cover it with aluminum foil and tape it, connect the red and green clips of the pachi pachi to the foil, and then spark the foil. That's a good treatment for skin problems that are localized. It basically forces blood and whatever into the skin. It kind of rejuvenates the skin. So it's a real, if you have a patch of something, you can do that. Now, of course, if you have oozing stuff, it's better for the dry stuff. Okay. There's actually I have a video on kawaii treatments, and there's a treatment like, quote unquote, a facial treatment.
Yeah.
And it's the same thing, except that with a face, you're covering the whole face. You're not doing because they have you could do it because they have acne, but it's more because, oh, by the way, can you do something to make my wrinkles look better? Okay, so I'll do that. And usually people, you can really tell that they, you touch the skin and it feels much more moist, much more alive after.
Okay.
So if they have, you just put a bunch of press tacks in, covered with the aluminum foil, and spark.
Okay.
Okay.
And what about someone with psoriasis who's deeply allergic to sulfur? Like she cannot tolerate any food with onions and garlic, and she was in Hawaii and the volcano erupted, all the sulfuric acid, and she ended up in the hospital just from breathing it.
Then obviously I would not wrap them with sulfur.
Yes,
and really
is there anything you would recommend for a sulfur allergy?
Whoa. Possibly. This I can't guarantee. Oh, but that could work for psoriasis, by the way. Mineral treatment. Because if she's allergic to basically quote unquote a mineral, so kidney 6, spleen 10, heart 3, small intestine 8, ren 6, and that actually can be a treatment for psoriasis because so it's interesting that she's allergic to psoriasis. So what happens is psoriasis is some sort of mineral deficiency, because what happens is people go like to the Dead Sea. It's not just, yes, you can get some improvement for sun exposure, but believe me, the amount of sun you get at the Dead Sea, I've been there, is no different than in Jerusalem, which is like on a mountain. Okay, so the difference is not in the sun, the difference is in the salt. Okay, the Dead Sea, well, if it still exists, because it keeps shrinking because they take all the water away. But the Dead Sea, it's the mud that's very salty, it's a mineral. So you can try mineral treatment for psoriasis also.
Okay.
And if she has a sulfur allergy, and maybe it's some sort of weird metabolism of minerals that she has that creates this. I'm unfortunately I don't know enough about how sulfur is used
Mhm.
internally in the body. I don't have that biochemistry, so I can't suggest enough on that.
Well, she's a geneticist, and she still can't, and she's done her genetic analysis, and she still can't figure out how to fix this problem. So
Well, you know, how is it that the geneticist children?
we poured over the genetics of the sulfation cycle extensively.
Sorry, you just became very elongated.
Yes, have no shoes.
Yeah. The genetics children have no shoes. Yes. So,
Yes.
but
Oh, never mind. It was supposed to be a joke. Forget it.
no, I kind of got the joke. Not quite the right expression, but my question to you is, how do you know what sulfur does? How the body utilizes sulfur normally? What is the purpose
Well,
of
I
sulfur
mean,
in the body?
we've looked extensively at liver detoxification,
Uh-huh.
and the problem is that, you know, it's she can't really tolerate activating the sulfation cycle, and so as she ages, you know, more and more of the toxicity builds up, and so it becomes more of an issue as time goes on. But how to release it without putting her in the hospital is the problem.
Okay. So question. Okay. So tell me, so because I don't know what the sulfuration cycles are. So tell me because if you tell me a little bit more about what sulfur does in the body, maybe I can come up with some ideas. Do you know what I'm saying? So, you know, let's, so what does sulfur do? I mean, so apparently it has something to do with the liver, or the liver is responsible for something to do with sulfur. So can you give me like the idiot's guide to sulfur in the body?
I don't know that I can.
Oops. Oh, bummer.
She went to benzenes. Oh,
Wait. You just got cut off, and the first word I heard was benzenes. So,
yes,
oh,
that's the critical word.
okay, the benzenes. Okay, what about the benzenes?
She had a lot of exposure to benzenes as a child growing up on a farm.
Ah, okay, pesticides?
Yes.
Okay, got you. Okay, all right. So okay, and well, the sulfur thing. Well, we can, you know, I'll research for next week and see if I can come up with something interesting on Google. I mean, thank God for Google. So, so the exposure to pesticides will suggest that, yeah, there's something in the liver, and I would start with kidney 9, large intestine 15.
Right. We have done that extensively.
You've done that extensively, and you got nowhere.
I don't think it, yeah, that hasn't made a significant dent.
So another question. Two possibilities. First of all, when you palpating her liver, anything there?
Well, certainly energetically, yes, huge, yes. And I have worked on that extensively as well.
Okay, so, and the other, okay, what about bladder 43 on the right side?
I have done that some, and
No, is it painful?
oh yeah.
Okay. And what have you done to release the liver? Just so that I don't give you the same old.
Well, I do a lot of qigong for it.
Ah, okay.
And you know, liver 4, liver 5.
Wait. Liver 4, liver 5 is not liver. Just so that we're clear. Liver 4, liver 5 is for when it's mainly related to the liver. It has to do with oketsu, which means the piling of the blood when the portal vein doesn't carry the blood to the liver.
Right.
smoothly.
Right.
But the liver itself, I mean, this is a case where we're assuming it's the liver itself. It's physically the liver itself. I would look at doing right side. So now so the official dogmas are these. If it's liver deficiency, it should be liver 1, or possibly liver 8, because fatty liver is a deficient liver and it works better with liver 8. And if it's liver excess, physical liver excess, in other words, she's had exposure to chemicals, there's a possibility there's actual physical damage in the liver, it's supposed to be right side, kidney 7, spleen 7, heart 3, pericardium 4. So these are just,
Can you say that more
yes, of
slowly?
course. I'm sorry.
The kidney 7.
Right side, everything right side. Kidney 7,
Mm-hmm.
spleen 7, behind the bone, look for the dent, heart 3, and pericardium 4, 3 fingers below pericardium 3. So that's the official.
That I have not tried.
Okay, it may be worth it because she may have, this is for actual physical damage in the liver, like cirrhosis, or you had radiation damage or something like that. So that may activate something that, the kidney 7, large intestine 15 wasn't able to, and then maybe kidney 9, large intestine 15 works better. That's one. The other thing is you can try go to do 20 and go to the side and look for a dent on the right side, obviously, for liver. That's another option. So now what else does she have in a medical history besides the exposure to the pesticides?
Celiac.
Okay.
She also had surgery on her abdomen and has extensive scars along the lower CV below the navel.
Below that, and what were the surgeries for?
The surgery, it was for her intestines.
Something to do with the celiac? No.
Can you hear me?
I can hear you in and out a little bit, but so the surgery was on the large intestine, not the small intestine, right?
Yes.
Okay, so not to do with the celiac.
No.
Okay, and what was the surgery for in the intestines?
Polyps, and I mean, to me, it was a needless surgery, but that's how it's done here.
Wait. She had polyps.
It was years before I met her.
Okay, and they did it. Okay, because now they go in rectally. So I'm just surprised. Okay, all right. So she had. Okay, if she had polyps, okay, in the intestines, chances are we're talking about liver 8. Okay, liver 8 is the point for any sort of accumulations in the body, fibroid cysts, polyps. These are all things. This is extra tissue growing in the body. Okay, and chances are, as you say, she's already a liver type person. So I would consider liver 8 as a point for her. The other point I would consider for her is possibly large intestine 2. Which affects the intestines specifically. But of course, large intestine 2, now there's 2 large intestine 2s. There's one where it normally is and one joint proximal. Large intestine 2 is good for all sorts of weird heat conditions in the body. Okay, I mean, you can make the Chinese arguments. It's Yangming, and it's the clear fire point. What are they called? The second point, the Ying spring point, supposed to release heat. But it's used for like eyes. It's used for gums. It's used for a lot of inflammatory kind of conditions in general. But specifically intestinal conditions.
Yeah.
Large intestine 2. And liver 8. So from her I'm basically trying to pick up from the medical history.
Yeah, and they did remove a section of the bowel.
They did remove. Okay. Do you know at which section? Ascending, descending, transverse.
Well, it's in the CV area, so
It can't be intestinal. I mean, it can't be large intestine. If it's in, they
yeah.
cut this. No, no,
So
no. Listen, they cut the
I
CV.
don't know. I probably should know. It never
Hey, it's we can't carry our patients all the time.
it never occurred to me to get that specific.
Yeah,
I
I would ask.
apologize.
Okay, so first of all, I think the fact
Yeah.
that the scar is on
So
the Ren line.
the other thing that's very significant, I think, about. Mhm.
Oops.
Go ahead.
Oh, we had a delay. So you started saying something, but anyway, the Ren line scar does not necessarily mean that this is where they actually removed something. Under the Ren line, you generally have the small intestine, especially around the navel. The large intestine basically is stomach line and more lateral. But the thing is, what they do is they may have cut on the Ren line because muscularly it's easier to cut there. And then what they do is they pull the muscles up and they go sideways. So there, just because there's a scar doesn't mean that the actual operation is underneath the scar.
Yeah.
The scar is just where they choose. I mean, you see this especially nowadays with laparoscopy surgery. Because the scar can be anywhere. It's meaningless.
Oh, this is a tremendous scar, and this happened. I mean, this was a long time ago, so
Right.
it was not elegantly done in any way.
Because they're very elegant nowadays, of course. No, I think what happens is because those kinds of operations, what you do is you open up everything from the center, you pull everything to the side, and they take the intestines out. They take the whole intestine out.
Mm-hmm.
And then because they didn't have the capacity, if they did it say 34 years ago, whenever, nowadays they still do that occasionally, but with laparoscopic surgeries, we have cameras and stuff, they can figure out what's going on. Then you didn't have the instrumentation, so they literally have to pull the intestines out of the body in order to see what the hell's going on, do whatever they do, and then shove it back in. Okay.
I suspect from the looks of this scar that sounds like about what happened.
Yeah. Yeah, no, I'm pretty sure that's probably what was going on. Therefore, the scar is meaningless in terms of what they actually did, because the scar was only there to basically expose the intestine and pull it out of the body and then play. So I would say definitely. I would also try spleen 9, by the way. Because she has an intestinal issue, and spleen 9 might be worth looking into and see what it does.
Mm-hmm.
And so you have multiple ways of ascertaining whether a point works or not. I mean, you can do it, quote unquote, the official way that I do it, which is check if pressure pain disappears. But if you're doing qigong on her, then you can also, you can needle spleen 9 or hold spleen 9 and see if the qigong field changes with a point. So you have many ways of verifying, obviously. Whoops. Are you there, Camille? Okay, I think Camille was swallowed by some intestinal thing on the phone. I mean, she appears still to be on, but I think.
Yeah,
Well, that's very helpful, Avi. Thank you.
Sorry?
Yeah, sorry, I thought, I was just going to say that I don't see you, Abby. I don't know what's wrong on my side. Can you see me?
I can see you, yes.
Oh, you're gone from my screen.
Oh, I think it's...
And I'm right here. I'm right here.
Oh, okay. Okay, so the way Zoom works is the person who talked last or the person who's talking is supposed to occupy the screen, but sometimes the Zoom is not so good at it, so sometimes it will leave the last person on. So that's might be why it didn't come through. But anyway, Camille, you got lost for a moment there.
So, Evie, would that kidney 7, spleen 7, heart 3, and spleen 4, would that be similar?
Pericardium 4.
Or sorry, pericardium 4. Would that be a similar treatment for like high liver enzymes for
Yes.
some? Yeah.
Yes, exactly. Yes. Because that is that when people have elevated liver enzymes, that is actual liver damage.
Yeah.
You know,
And
you can assume that if you went and did a biopsy, there'll be physical damage in the liver.
okay.
So.
Okay. And would you add anything with that, or?
No, well, you can add, but in terms of liver, that is like a quote unquote, this is its own protocol for liver. Now you can add, you know, so for example, in this person, I might still add liver 8, even though it sounds a teeny bit contradictory, because you're treating liver and then you're treating liver again, but, you know, from a slightly different angle. But liver especially has this capacity of having multiple things going on. Sometimes one strategy doesn't work on the liver. It's just the nature of it.
Right.
So.
Okay, thank you, Effie.
You're welcome. Camille, are you still there?
I am. Thank you.
All right, good. So anything else worth looking at with this person? And you know, you could, you know, Nick, maybe if you look at it, then next week we can revisit. I'll try and look at this, what the sulfur does in the body and see if I can come up with things.
Well, and the other thing that is significant about her health history is that her mother had very severe rheumatoid arthritis and alcoholism, and died when she was very young from her illness, and I do feel that the mother's health history is pretty significant.
Yeah, well, the rheumatoid. Okay, so the rheumatoid arthritis. So your patient, the daughter, sounds like she may have also inherited some autoimmune factor.
Absolutely.
Okay, then in which case definitely treat then the first thing I would start with, because if you're looking at the history of the possibilities, if we're saying, okay, there's an autoimmune disorder that's inherited, even though genetically she can't prove it, you know, and if she can't, apparently no one can. But the thing is, prior to the exposure to the pesticides, you know, that may cause, there is already a weakness in terms of there's the autoimmune is lurking there. Okay, so I would treat autoimmune, then I would treat the liver, or then I would treat either detox liver or liver 8, and or I would treat minerals. Now notice that a lot of these overlap in the sense that they all, just about all of them, contain kidney points. Okay, autoimmune contains kidney points. The liver excess treatment contains kidney points. The liver treatment for skin, for detox, is kidney 9. By the way, it doesn't always have to be kidney 9. Kidney 7 sometimes can do a good job for detox also. Okay, and so whatever it is, you're coming back to the state of her kidneys. Okay, so even though there's a liver involvement, and you can say there's even and the large intestine comes later. Okay, so if I'm going back, given the history that we have right now, if I'm going back, autoimmune rheumatoid arthritis is the strongest. The possibility of the drinking, the mother being an alcoholic, is there because we don't know. Number one, a few things. We don't know if mother was drinking while she was pregnant.
I suspect she was.
Right.
I believe she was.
But also the other thing is, so if somebody says, well, my mother was an alcoholic, that does not mean that they have a liver issue. But if they say, my mother, my grandfather, my great-grand, you know, like I come from a whole generations where everybody just, you know, drinks every day like it's St. Patrick's Day or something, then that's...
No, I don't think that's the case. I don't necessarily think there's a huge, she's not mentioned a broad familial alcoholism.
Okay, so that's that when you have generations of it, eventually, you know, I can't say at what generation, but it will start affecting your liver even if you never drink at all. Okay, because, you know, like little by little, you know, the genetic code starts to change a little bit. Okay, so so there is a possibility, you know, so the alcohol, I can't say if it's genetic, but it could have affected her in terms if mama was drinking while she was pregnant. So then, you know, your genetic points are basically bladder 53 and bladder 43.
For any genetic problem.
Any genetic problem, because genetics, okay, so when you're looking at genetics, you're looking at, you know, this character Huang, you know, so you know that's something that's dead, that's still in the body, because the character literally says missing or buried, and the body, you know, it has two components to the character. So the Wangs are basically, you have bladder 43 is the Wang point, Gao Wang Shu, which also relates to liver. You have bladder 53, which, you know, Bao Huang, the uterus Wang. And then you have kidney 16, which, by the way, relates to allergies also around the navel. Which is Wang Shu. Okay. So I would start looking and playing with those three as well. So, you know, you just, you create a mishmash of all these ideas, and you test them out in whatever manner you choose to test, and come up, you know, but it just expands your idea possibilities. It expands the palette, so to speak.
Okay. Interesting.
Yeah.
Very helpful. And I'll see what I can do to try to describe the benzene sulfur.
Okay, great.
Whole thing better.
Great. Okay. Otherwise, I'll have to go dig for oil somewhere and find the benzene.
Yeah. No, you don't have to dig for oil. I'll try to oil it, and I'll try to write this up, because there are a few other pieces as well, and I think it's quite interesting. So anyway, it happened again. Mary Jo asked a question, and it kind of triggered me. So thank you, Mary Jo, and thank you, Ami.
Thank you.
Great.
And we'll talk next week.
All right.
All right.
Thank you.
Thank you so much. Bye-bye.
Bye. Bye.